If anybody thought up till now that the Italians were incompetent, well, we have a new club. We have a new club where the UK and the national health system bosses, as they're called, are about to commit suicide. And with that, they're going to commit suicide and harakiri for the whole of Britain. This is just unbelievable. Watch this and warn your government that this is not the way to go.
In the meantime, NHS England bosses are appearing before the Commons Health Select Committee.
Be symptomatic and to have any risk of infecting other people for the initial part of the time that they've been exposed to a family member. So actually the risk is that you continue to stay exposed to that family member.
So I'll translate. If you're a doctor or a nurse and in your family somebody has been infected with COVID-19, if you stay in that family, you risk being infected as well, if you already haven't.
An extended period of time, and then of course you can't work because you're at much higher risk of both getting the virus and passing it on.
Okay, so your family have been infected, you could pass it on, and what are we going to do with you? And you're a doctor or a nurse?
You have been tested, and we know definitely, and the staff member knows for themselves, that they are negative. But for the moment, what we would want to do is say to people, if a family member has been exposed...
Nobody up till this date, 17th of March 2020, have been able to figure out how long the incubation period lasts. So I repeat, you have a doctor living with his family. Somebody in the family got coronavirus. They've been tested positive. They've tested that doctor. He hasn't been yet tested positive. And what are they going to do with him?
Then absolutely, if you wish to continue working, as long as you're not going home to that person, then if we can offer you accommodation that allows you to continue to work so that you're separated from that family member, then we would wish to be able to do so. Now, clearly, in that circumstance...
For the sake of being boring, what they're going to do with this person is put them up in a hotel and then let him carry on going to work. Now, this guy here is Jerremy Hunt. Jerremy Hunt is an ex-health secretary of the UK, and amongst the millions of positions that he's held in the past, he is actually the Health and Social Care Select Committee Chair. It oversees the operations of the Department of Health and Social Care. This is one of the top people who are looking into how the healthcare system is managed. And you follow this. You follow his expression because obviously in this situation, he's trying to be diplomatic. We have an emergency in the UK. Well, no, we don't. People are still going to the pubs. But he's not going to be provocative. But just look at his face and listen to this crap woman, and she should be fired, and so should the other three people sitting next to her. Listen to her blabber on about how we have a doctor who is now infecting a whole hospital. And listen to his question.
If somebody then became symptomatic, we would expect them to, as now, then immediately remove themselves from a work environment and do all of the things that we've issued as guidance to anyone who finds themselves in that situation.
But so I understand, so you are satisfied that if someone's has a family member who becomes symptomatic, without doing a test, it's okay for them to carry on working in the NHS with vulnerable patients without doing that test if they live in a hotel separately to the family. That's the advice you have.
Watch her, no answer. And then watch the other rats next to her try and put out the fire.
So I'll let Steve come in, but there's a bit of judgment.
This relates particularly to the new policy introduced yesterday, which is if a family member becomes symptomatic, then the rest of the household should isolate for 14 days. And clearly that has an implication for NHS staff, and as you have alluded to earlier, we have heard very clearly from organisations that of the potential impact of that.
Yeah, the potential impact is if you get a doctor who's been living with his family and he's been infected, or somebody in his family has, if you put him into a hotel and tell him, yeah, carry on working in the biggest hospital in London or wherever, he's going to infect many more people, not to mention his colleague staff. This is really beyond belief.
So this is one way, and it's absolutely not for everybody.
Oh, so it's absolutely not for everybody. According to which criteria? For who is it not to decide if I'm infected or not? Oh, it's not for everybody. Fucking hell.
For exactly the reasons you described earlier around home circumstances. But for some...
This is Professor Stephen Powis, Medical Director, National Health System, England. This guy needs to be fired. Now. Somebody who... Let me have a glass of water.
Relatively become symptomatic.
Symptomatic means that someone who's showing the effects, yeah? Temperature, sweating, heavy breathing, sore throat, symptomatic. So our so-called doctor who they put into a hotel, who's been living with his brother, for example, who's already symptomatic, has not got the symptoms yet, and he can go to work.
Actually, I'd like to continue working for a period of the next few days.
You can't decide that you'd like to continue working for a period of days. If you've been living with a family where a member has been infected, in most of the civilized world, like in the whole of Europe, you are put into quarantine as well.
I'd like to have accommodation.
I'd like to be a millionaire. Jesus Christ.
So that I can continue working. It is an option, but it's absolutely not for everybody.
It's not a fucking option, and it isn't for fucking everybody, you... Oh, God, I don't want to swear. I don't like swearing, but England, wake up.
Because I just want to understand, because obviously you're...
Jerremy Hunt is still trying to be diplomatic. He's not going to give these idiots the straight question is, what the fuck are you talking about? But anyway, he's going to try.
Seeing the medical director, that if you have a symptomatic family member and you work for the NHS, rather than self-isolating, it is okay for you to carry on working. It's safe for colleagues, safe for patients, providing you leave your family and stay in a hotel. Clinically you're saying that is safe.
It isn't safe. It's suicide. It's kamikaze.
For people to do that.
Clearly, it depends when the symptoms started for that symptomatic individual.
Oh, yeah? And we know when. Do you know when? No, because you... Oh, please, God, don't...
But if the symptoms have started, for instance, when you were at work, if you get the phone call, the symptoms have started, or...
So I was at work and I got a phone call while I'm at work and somebody phoned me to say my symptoms have started.
Been on call overnight and not been there for a couple of days. Yes, because as we said earlier...
If I've been on call over a night and I haven't been there for a couple of days, either I'm visiting local brothels or I've got the first symptoms of COVID-19. Jesus Christ.
The infectious period is during the symptomatic period. But
the infectious period is during the symptomatic period, but this doctor is not yet symptomatic. He's living in a hotel and going to work. So he is infective. He can infect other people, his colleagues, doctors and patients.
Absolutely not for everybody.
It's absolutely not for everybody. Well, my friend, I have news for you. Mr. Professor Stephen Powis, the coronavirus is definitely not for everybody. Welcome to the club, you fucking idiot.
And it needs to be used with discretion.
Yeah. I would say this is about getting them... You've got two choices here.
Here comes the next fireman, the next panic fireman. We have two choices.
So someone who's had an exposure, be it a very mild early case exposure, saying, right, we're not going to put you in, lock you in and...
We do not know up till now what is a mild exposure or 150,000% exposure. Exposure is exposure. If you get AIDS or if you get Ebola, you've been infected. It's not mild, you've got it.
Quarantine alongside someone who we know is going to become more virus spreading over the next sort of...
Oh, we know somebody who can become more virus spreading. Yes, exactly. The doctor who's living in a hotel and going to the hospital.
8 hours and become unwell. Park you out, carry on, but we'll watch you very carefully.
Oh, carry on. Oh, dear. Carry on. How are you going to watch him carefully?
And if you do get any signs of infection, then you'll go into self-isolation.
Yes, after he's been in a hotel and working for another 5 days in a hospital.
If you've been with them all weekend and you've been exposed, then clearly...
Oops.
That would be inappropriate.
Well, that's not what the woman said, and that's not what half of what you just said meant. Jesus Christ. These people should be fired. Fire them all. Get some Italians in there.
Isn't there a safer solution, just to put that particular person right at the front of the queue for the next test?
Well, the test duration, what are you going to do with them? We're going to put them in a hotel.
No, if somebody has a test, you don't put them in a hotel, or if you do, you make them stay in the hotel. You do not let them go to work in a hospital.
I guess, aren't you? You've got to separate them. You don't want to put them back into the environment where they're at risk.
Which is that we need a lot more testing capability for NHS staff.
Yes.
As it happens, the first in the queue should be symptomatic NHS.
No, the first in the queue should be a doctor who you let work in a hospital whilst he's living in a hotel when we know half his family have got the virus.
Staff, rather than the asymptomatic family members of somebody who themselves, their relative is in isolation.
Jeez.
But as we get more testing, we absolutely want to be able to test test NHS staff as quickly as possible.
So basically, the moral of this story is they do not have enough options. They do not have the staff to do the testing. They haven't got enough tests in the UK. Come on, guys, admit it. And they're not sweating. I'm sweating.
So that they can then go back to work if they are negative.
Final quick question from Dean.
I just wanted to jump in on that, which was akin to your question really around the testing piece of it. Because are you saying that at the point that tests do become available?
They are not now at the moment, though.
With that guidance, the first instance would be to test them rather than put them in a hotel.
Of course it would be. Let's see what this cunt says.
The first instance will be to test symptomatic NHS staff.
No, it wouldn't. It would be to test people who are asymptomatic, who've been living with a family who are symptomatic, if they work in healthcare. The doctor in the hotel should not be working in healthcare until the usual quarantine, or if you do a test on him and leave him in quarantine for 14 days. 14 days is also another joke. Anyway, let's hear what this cunt has to say.
And then the wider net will be the group that we've just been describing.
Oh, the wider net, yeah. What are you talking about?
And that's why we are obviously very enthusiastic that Public Health England, the Department of Health procurement team and so on are able to expand the volume of testing available in this country.
This is like the orchestra on the Titanic when they're already 2 feet underwater. If this wasn't terrible and sad, it would actually be comical.
So our priority at the moment is clearly to test patients, and
Yeah.
that's right.
Test patients. Yeah, what about doctors?
I would support that, but as testing ramps up, our absolute next priority, as we have said, is to ensure that NHS staff are tested.
But not left in a hotel and allowed to go to work if we suspect they could have been infected.
One, so that they know that they can come back to work if
How do they know without being tested?
they are negative, but actually
Nobody knows they're negative until they've at least up till now spent 14 days in quarantine.
knowing who has been positive is also important, because we will then be developing a group of staff who will have immunity to this disease.
Yes, but in the meantime, the staff who've got immunity have got immunity, but you're still letting loose the doctor from the hotel.
And will therefore be more confident in their ability to provide care.
It's a busy, busy time. Thank you for being so generous with yours. Thank you.
And I will translate that into normal international speak. He would have wished to have been able to say, "Fuck off, you idiots." If this is the best you can do, Jerremy Hunt, for your support team for the Health and Social Care Select Committee, these people must be fired immediately. The last part, where this journalist on Sky News has got another ferret in the studio, and now Sky and that guy are going to try and put the fire out.
Hearing from the NHS England bosses there in a lengthy session, also heard a little earlier from the Chief Scientific Advisor, Sir Patrick Vallance. With me in the studio is Dr. Simon Clark, and
Right, well, he's not looking very pleased. He knows that the shit has hit the fan.
Biologist at the University of Reading, listening to that evidence. And just to get your reflections, that last session of evidence, a lot of questioning about whether or not NHS workers should be prioritised in terms of testing for coronavirus.
Yeah, I guess there's a substantial question around how many of them are kept at home unnecessarily if they're living with people.
No, the question wasn't left home unnecessarily. The question was not left in the home where there is infection, put into a hotel, but allowed to infect other people in hospitals. But anyway, let him finish.
Who have tested positive. They're going to be put under the 14-day quarantine, but they
But the doctor in the hotel isn't.
may not need to be quarantined.
Yes, they do.
And that takes them away from the hospitals, from our health service for
Thank God they don't infect other people.
2 weeks unnecessarily, potentially.
Potentially. Well, my friends, coronavirus doesn't survive potentially. It doesn't infect people potentially, doesn't kill people potentially. It does it factually.
I have to say it was a little confusing,
Right, now, this woman, fair to her, tries to dig a little bit further.
wasn't it? And it's no wonder that many people are feeling confused about how they should self-isolate and when, because they were being asked about potentially giving hotel accommodation to NHS workers who may have a family member who may be displaying symptoms, and was a little vague on at what point that would be safe for them to continue working.
So now, up till now, he's been listening to her for the past 15 seconds and he's thinking, oh God, if I don't say something which makes sense, I am going to lose my credibility. And finally, we get some sense from someone, even if he's not very pleased to be admitting this.
Yes, and they'd have to, before they put somebody into a hotel, they'd have to make sure that they weren't carrying the virus asymptomatically beforehand.
Yes, but they haven't put them into quarantine.
So I'm not quite sure what the thinking there is.
Oh dear, you are a genius.
I don't think it was very clear.
No, but a lot of questions about testing.
Now she now tries to put the fire out because the cat's been let out of the bag. She can't say obviously now that, oh, finally you told us the truth and those people are lying. So she's got to put the fire out a little bit more.
Whether it should be ramped up in order to get more workers back into the NHS and out of self-isolation and quarantine.
Poor woman, poor man. Jesus Christ. You guys in the UK, if you've watched this, I mean, common sense must tell you that the fan has hit the shit. And with people like this, supposed to be sorting it out, you English are really fucked.